What is a nursing home or a SNF, skilled nursing facility, LTC, long-term care facility, acute rehab facility, sub-acute rehab facility, post-acute rehab facility? But basically, we're asking the question, what is a nursing home? We have a special guest. Theresa, could you introduce yourself?
Hello, everybody. My name is Theresa Pardalis, and I'm the Assistant Administrator with Life Source Hospice, and I'm a nurse navigator, and I help people find the services they need across the entire healthcare continuum. I have my expertise is my nursing career of 35 years, and my sharing with my patients and residents and sharing their expertise. So what is a nursing home? Well, that's a question I'd like to try to answer for you here today. The perception of nursing homes has changed so much over the years, and the services they provide are so different. Years ago, we didn't have assisted living facilities, we didn't have care centers like that, we just had one choice. It was a nursing home. Now, we have so many different definitions, and it can really get confusing when you start Googling up some of these titles that people talk about. So let me start with the nursing home as we think of it. A nursing home, as I think most people think of it, is somewhere someone might go to live that has nursing care available. And it's usually synonymous with a skilled nursing facility because a long-term care nursing home is going to have nurses available, they're going to have aides available for personal care, they're going to have resident assistants of all different types. They're going to have activities. They're going to have ways to enjoy your quality of life while living in this community. The next level of care, which is frequently provided within a nursing home, is sub-acute rehab, and you'll hear that. Sub-acute rehab is just what it's called. It's under acute. Acute is after the hospital. So sub-acute is right under acute. It's a little less level of care, of acuity from the hospital. You can have physical therapy, occupational therapy, you can have speech therapy. The nurse can take care of your wounds. They'll do medication management. There's a lot of teaching going on. The point is to prepare to go home and get back to the quality of life that, is your highest that you can reach. The other type of facility is an acute care center. Acute care centers are for people that are quite ill. It's a very high acuity. And when you think of acuity, the word means like nursing intensive. So it's just a higher nursing intensive center. So people that might have respiratory issues, including tracheostomy tubes or ventilators or complicated stroke patients, might go from a hospital setting to an acute care center. And at those acute care centers, they get more care, they get more rehab, they get a higher level of acuity, and the insurances will allow that for a certain amount of time. Then once you've reached your maximum potential there, they will then allow you to go to the sub-acute facility. Another service that's provided within these communities is respite care, and respite is just what the definition implies. It is care to relieve some of the family and caregivers' burdens for a short period of time and provide the care the patient needs within a community. So you can come in just for temporary respite. It can be 5 days, it can be a week, it could be a few months. We've had people traveling out of town and the family comes in, and then the goal is still to return home.
Theresa, that was really helpful to hear your explanation. And I just want to get something clear. Post-acute is the timing. It's anywhere you go after acute care. Is that correct?
That is correct.
Okay.
All those choices are post-acute care.
After the acute, which is normally a hospital.
That's right. And hospitalization is acute level care.
Okay. And then subacute, it's not the timing, but it's a lower level of acuity.
Right, as it implies, sub is under, so it's right under. It's just a little less acuity than the hospital.
And then with all these levels of care, is it common to find patients or residents in the wrong place, in the wrong level?
It is common. It does happen, but we don't really consider it a wrong level because it's part of the continuum. If you've gone to the hospital, they may only know you for a very short time and evaluate rather quickly in an attempt to get you out of the hospital. So it's really then the post-acute care that is going to really determine your functionability, your maximum potential, things that can be done. So sometimes you may go to an acute care center after the hospital, and then you may not be able to meet the expectations of the therapy requirements and such. So within a few days or within a week or so, they can move you across the continuum to a subacute facility.
Got it. And here in New Jersey, give us some examples of a place that's still considered acute care, even though it's not a big university hospital.
Another definition that I would like to clarify that you'll hear is LTAC, and that's a long-term acute center. And what that is that's after the hospitalizations, because hospitals are considered acute centers. But post-hospitalization, when you're into the recovery portion, you may still need that high level of acuity, but now we want to add rehab to it. So if we're going to add rehab, you're going to go to an LTAC center. Those are centers such as Kessler, Select Specialties. St. Peter's has an LTAC connected to it. There are just some hospitals that have LTACs. And then after you've had a certain amount of time in the LTAC and they've been able to work out more of your critical care problems as well as tie in a little rehab, then frequently people will move to a subacute facility to continue their rehab. Then after the time allotted, they will either be discharged home or they may stay in a long-term care center pending their medical needs.
Wow. And then just to be technically know more about this, is it okay to call an LTAC a hospital, or technically no?
Yes, it is okay to call an LTAC a hospital.
Okay.
It is billed under hospitalization on all the benefits as well.
Okay, got you. But then a subacute, you would not call a hospital.
No, you would not.
Okay.
But I do have to tell you that in the times and with medicine the way it is, I do believe that the acuity is going to change at these subacute, and there will be higher and higher acuities in an attempt to keep people out of the hospital. We want to treat more in place, and that really is better for the resident and the patient.
Great. And then lastly, give us some context of why some professionals don't like to use the word nursing home or think that it's politically incorrect or wrong, and why others feel like the phrase is perfectly fine to use.
I think it's because of a stigma. I think it's a stigma from long ago. When I ask some of my older patients, much older patients, they are sometimes fearful of the word nursing home. If you say it's just like the biggest fear was being left in a nursing home. Fortunately, these facilities have changed. We barely call them facilities, we call them communities. We want the people to feel like a part of a community. So it's not just a place you get medical care, it's a place you can live, and we are concerned with quality of life as well.
Right. So you think the phrase is here to stay, though, nursing home?
I do, because we still slip back to it even when we try to avoid it. And I think some of it might be related to some marketing, and people know that people get a little uncomfortable sometimes with that phrase.
Right.
But it is a nursing home.
Right, got it. Thank you so much for sharing with us.
Thank you very much.
Yeah. Thank you for watching. If this was helpful, please press subscribe so you could see future videos. See you in the next one.
Thank you.